Hi everyone, this is Adrien, the exercise specialist at the Leduc, Beaumont, Devon Primary Care Network. Hope you all are doing well today. For today's video, I thought I would show you guys some exercises to work on potentially preventing or helping to treat the symptoms of carpal tunnel syndrome and like I said, the related symptoms of it. So to start off with, what is carpal tunnel syndrome? So carpal tunnel syndrome itself kind of presents as a condition at which what is known as the median nerve, which is a nerve that runs deep inside your forearm there into your hand, when it actually gets compressed or squeezed kind of at the location of the wrist. The median nerve has to pass kind of in a bit of like a passageway kind of in your wrist. It has to pass through some actual ligaments and some bone right at the base of the hand, and it can get compressed in there. And that's when carpal tunnel symptoms can start to present. Now, what are the most common kind of symptoms that people exhibit from carpal tunnel? The most common one is tingling and a numbness in the hand, usually in the thumb and the pointer finger, and or in the middle finger and the ring finger. Based on my understanding of carpal tunnel and what I've seen in patients in the past, your pinky or your small finger or your final finger, as some people call it, is usually less affected, as it's not a direct nerve pathway of your median nerve. So something to keep in mind. Another common thing that people often experience is weakness in their fingers or in their hand. Another common one, or sorry, a lesser common one, some people also can experience is a bit of a shooting electrical pulse, going up or down. Usually it's going down, but it can go up as this is the actual root cause of the issue is right here. How does it tend to happen? The most common way that carpal tunnel issues begin is actually from overuse injuries, chronic strain injuries, so on and so forth. So how do these occur? So these occur by usually from poor posture and poor ergonomic positions in the workplace. Anyone that has to work at a computer all day, or in an office and has to sit and has to sit. Anyone who is sitting at a computer and has their wrist up like that all day and are typing all day, or is down like that typing all day. Usually it tends to be this way, but it can be that way too. It causes a lot of strain over time there with the constant finger movements while being in these poor angles. It causes compressions in there on that median nerve and inflammation and so on and so forth. Obviously, just to go into the ergonomics briefly, you want to try to keep your hands roughly parallel to the floor when you're typing. So elbow to wrist to tips of fingers, roughly in line. So when you're sideways and you're typing, back up so you can see my arm there. It is right here, right? So I should be typing right at about this angle, right? I shouldn't be typing up here. Should not be typing down here. I want to be right here, roughly 90 to type, if that makes sense. Straight lines and right angles are the most efficient way for energy to be produced and forced to dissipate and to reduce strain and things like that over time without getting into kind of the real nitty-gritty of ergonomics. So roughly a 90 degree angle from your shoulder to your elbow to your wrist. So we don't want to be typing like this, don't want to be typing down here, right at 90. So that's going to be the biggest way for most people to prevent carpal tunnel and things like that. It's often chronic overuse and things like that with the poor ergonomic kind of a position. It can occur, I've seen with people that do certain really wrist heavy sports, involve a lot of throwing and flicking and twisting and things like that, but that's a little less common. So before we get into the actual exercises that I often show people, just as per usual, if you're new to physical activity or if you're returning to physical activity from a layoff, or if you have a physical condition that might make doing physical activity difficult, please consult with your physician or your healthcare professional prior to beginning any new exercise program. So yeah, these aren't really meant to treat any one particular person. I can't guarantee that if you experience symptoms of carpal tunnel that these will solve all of your problems, as everyone is unique and kind of responds to things in unique ways when it comes to carpal tunnel, as well as most conditions. There's no cookie cutter, one fits everyone kind of a thing. So just to keep that in mind. But these are often some exercises that I recommend for people, and from my knowledge, it seems to be pretty well kind of expected and kind of a rough standard protocol that a lot of professionals tend to give out to people. So keep that in mind as well. So for all of these exercises that I'm going to recommend for you, there are there's tons of rep schemes and protocols. I'd say in general, people try to just keep it simple. Try to do all these exercises for 2 to 3 sets of 8 to 12 repetitions. Everything should be done nice and controlled and slow. No jerky, crazy movements. Nice and slow and controlled. Okay. So I have these laid out in a particular order. This is not particular to like this is the order they have to be done, but this is generally an order I find to work well for a lot of people. Everyone is individual and everyone gets these switched up in certain orders, and some of these I take out for certain people due to pain and things like that, and some other ones I put in. But this tends to be just a bit of a standard kind of a protocol that I would do. So the first exercise is actually just to shake out your arms. So you can see your arms a bit. So I would let my arms hang down at my side, so they're hanging down on the ground here. And I'm just gonna shake my arms out, shake it out a bit. Just get the shoulders going a little bit. Just shake it out, trying to get things nice and loose in my arms. They're just nice and loose. Let my arms flap around. It's it's nice to do. I do this anyway. So that tends to be the first exercise. It's that simple. Second one is to work on some basic wrist deviations. You can do that without any resistance, and eventually over time build to resistance. So what I mean by a wrist deviation, today we're actually going to be doing what is called our radial deviation. So you have the two main forearm bones. You have your ulnar and your radial, so we are going to be focusing on. So we are going to be focusing on the radial. So when we deviate, we are kind of breaking the actual plane of your radial bone or your radius bone, right? So what we're going to be doing is you can kind of keep your arm, by your side. You can support it on your armrest if you want. But all we're going to be doing is focusing on taking our hand, and rotating it upwards, and then back down to neutral, upwards, back down to neutral, upwards, back down to neutral, upwards, back down. As you see, I'm not jerking, going all crazy around the place. It's not spastic. It's just up and down, up and down, up and down. If you want to add a bit of resistance, you can use your hand on your fingers. I wouldn't use a ton of resistance because this is not a very strong movement for anyone, but a little bit of resistance, up and down, up and down, up and down. So that is one option. The next exercise, that I move into is a basic elbow extension, elbow flexion movement. So like a bicep curl. For people with carpal tunnel, I often recommend not using any weight. You can build up to a little weight over time, but for most people, no weight is going to be the way to go. So you want to have space where your arm can hang right down, right? So this is called elbow extension, and then we want to do the curl, which is elbow flexion. Okay, so down and up, down and up, down and up. I mean, really deliberate with the movements. Down, up, all the way down, all the way up. So I'm elongating the bicep as much as possible, shortening it as much as possible. So that's exercise number 3. So exercise number 4. You want to rest your elbows on something. You can have your elbows elevated, but your hands elevated this time if you want, but we're focusing on here is deliberate finger opening and spreading and closing. So we're going to open and close, open and close, open, and you really want to stretch, right, and close, open and close, open and close, open and close. Awesome. So the next movement, we are going to do a bit of a stretch for the forearm flexors here. So on the inside of your forearm, so on the same side as your palm, these are your wrist flexors. On the back side of your palm, these ones here are your wrist extensors. So these ones do wrist extension, these ones do wrist flexion. It's that simple. Anatomy really isn't that difficult when you understand kind of the basic movement planes anyways. So we are going to move into some wrist flexor stretches now. So which means we go into wrist extension. So over here, you can always start with your arm, you know, kind of bent if you want to. It becomes a more intense stretch if you straighten out your arm. So you see, I am doing that. I'm straightening out my arm, and then I'm pulling back to stretch those muscles on the inside of my forearm or my wrist flexor muscles. So you can hold this for, you know, 30 or so seconds for about three times, depending on how tender this is, because this one can sometimes exhibit a bit of pain on people. You know, you may want to push, you may want to pull a little less, even just use your hand, but you know, a little bit of overpressure can be helpful as the pain starts to subside to really stretch things out. And you know, both sides, so on and so forth. For 3 sets of, you know, 30 or so seconds. That's to be a good place to start. So the next 2 exercises are actually what are called nerve mobilization kind of movements. So these are movements that I more recommend doing if you've had a healthcare professional actually show you how to do these. They're not difficult to do, but I do definitely recommend trying to have a healthcare professional actually show you how to do these first in person, because they take a little bit of time to get used to figuring out how to do it. So these are specific stretches done a very specific way that are actually done to actually, once again, to help mobilize the actual median nerve there. See if we can, you know, give it a little more breathing room, you know, so things are able to so things are actually able to, you know, flow properly, so on and so forth. So usually these are done standing, but I'll just do them sitting today. You need a wall. I only have a window here, so it won't be the best example, but that's okay. So for these, what you want to do is you want to find the wall here, which my wall is right here. Well, let's say my wall is right here. It's an imaginary wall for me today. You want to start out with your elbow bent. You want to be standing up straight, fingers pointing upwards. And then what you're gonna do is you're gonna push off the wall while still keeping your palm up. So I'm straight, you know, and pushing off the wall in a nice straight line. See, and that's actually quite a good stretch right there. So I'm completely parallel. My arm's not forward or backwards. I'm aligned with my shoulders, and I'm stretched, pushing up against the wall, and back. Ooh, that's even a stretch without the wall. So the next version of it is the slightly more intensive version of it. So for this one, we're actually going to take our palm, we're going to turn it outwards a little bit. We're going to externally rotate our hands slightly. So instead of being like this on the wall, it's now like this. And we're going to place it on the wall. And then what we are going to do, so we're going to start here bent, we're going to straighten it out. Now we are here. Now we're going to bring our ear to our opposite shoulder. See, I can feel it all the way down into my fingertips. So I know that that's working. I can feel it in my thumb, my pointer, my middle finger, and my ring finger, but not my pinky, because it's not affected by the median nerve. Oh, that's a fantastic stretch. So obviously you can do that with a wall there, makes it more intensive. You can do it without a wall like I just did too. I just put your arm out, you know, palm back, parallel, and then bring that neck down. It's a fantastic stretch. It can get pretty intense of those, so be mindful of that. So the next one is just another way to do the same kind of a wrist flexor stretch. As you tend to notice, the flexors tend to be more affected than the extensors. So we gotta stretch those actual flexors out, because it's usually in slight extension where the issues occur. So when extension causes the issues, you gotta work on flexion. When flexion causes the issues, you gotta work on extension, so on and so forth. So they always play off each other. Flexion and extension are opposing kind of forces in the body for all movements, right? So flexion is the shortening of a muscle. Extension is the elongating of a muscle. But that's not what this video is about. So next one is a basic kind of the praying stretch, as some people call it. It's also known as a bilateral wrist flexion stretch. Through a bilateral wrist flexion stretch through extension. If you want to be real fun with it. So here, obviously fingers are together, as you'd see here. And I'm pushing down, and then the further I push my fingers down, the more intensive of a stretch that it gets. And you get to work on both forearms at the same time here. So it's a good stretch. The last two are more kind of precise, kind of intensive intrinsic movements. First one is kind of an alternating finger touch and flexion movement. So this one, you take your hand and you start with each finger. So you go one finger, and then what I'm actually doing is I'm going to try and push this finger down while my thumb kind of resists. So they resist each other, and I go up. And I go. They resist each other. I come up, and they resist each other, and then they come up. And though your pinky is left involved, you don't want to leave it out. You want it to be involved just for overall uniformity and hand health. So your pinky too, and up. So I'm squeezing, 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 and squeezing. So that's a fantastic movement that you can do. So going through each finger would be one total repetition. So 1, 2, 3, 4. Obviously not that fast. Do it the way I showed the first time, but that's just to explain it. So once again, a couple sets of 8 to 12 repetitions or so. You'll be feeling that in your forearm. The last exercise is a basic kind of a grip test. Now I wasn't able to find a good example of how to do this one. But actually this could work here. This could work here. This will work not too bad once I get this out. So I have a tensor bandage here. You can use this for other things. Obviously when you have carpal tunnel, sometimes you got to use hand wraps and things like that. But this one, we've all done this before or seen this before, where we take a stress ball or something similar, a tennis ball, a soft hockey ball, something like that, and we work on squeezing it and then releasing. Squeezing it and then releasing, squeezing it and then releasing, squeezing it and then releasing. So see, nice and controlled. This one, I often will get people to really squeeze for about 10 or so seconds, pretty hard, like an 8 out of 10 effort, and then relax. That's one repetition. So that one can get pretty intensive too. And that's the final exercise that I wanted to show you guys for the. So yeah, so it's a 10 exercise protocol. Sometimes what I'll get people to do is to break them up and do the more stretching movements, every day or a couple times a day, and get them to do the more intensive movements, like the more axis resistance training movements, once a day, different times than when they're stretching. The whole thing shouldn't take more than 10 to 12 minutes to do. Obviously this video is a little longer than that because I talk a lot. Sorry about that. But I hope you all found it helpful. These generally can be done pre and post carpal tunnel release surgery if you do end up having to get it done. Obviously, base that on the treatment provider that you're seeing in the program that they recommend. As I give people different programs depending on where they are in kind of their process of recovery. It depends on the individual. This is just a good kind of clear, kind of basic, rough standard example. So I hope you guys all found that helpful. Please like the video and subscribe to the YouTube channel. My name is Adrien. I'm the exercise specialist with the Leduc, Beaumont, Devon Primary Care Network. Thank you so much and have a great day.